Good morning, good afternoon, and good evening to everyone who's joining us. Thank you very much for coming to join us with the Impact Through Operational Excellence panel. My name is Catherine Hoflick. I'm the Senior Capacity Advisor for USAID's Office of HIV/AIDS. I am really excited to be here this morning. It's bright and early, but actually not even bright outside yet. The sun hasn't even risen here in DC, but I think we have a great panel for you today. I think you'll find a lot of really excellent information and learning from our three panelists today. So I am joined by Daniel Kaptimer, who is the Grants and Compliance Manager for the Integrated Services for Health and Development in Ethiopia, Wanjiru Gitega, the Financial Management Specialist at the Center for Health Solutions in Kenya, and Jerome Burke, who is the Communications Coordinator for Jamaica AIDS Support for Life. So we have, quite different experiences that we're going to be presenting on today, from sub-awards management to financial management and ICT and communications. So I hope that you find this to be a very helpful panel. Please introduce yourself using the chat function. I see a couple of people are starting to put your name and organization in the chat, so please use that. And also, please use the Q&A function. We're going to have time at the end after the presentations to pose questions so we can ask directly from our expert panelists here today, about their experiences and learn further. So we'll pause at the end for answering questions from the chat. So definitely be using that. Also, feel free to, if you would like to listen in French or Portuguese, you can do that. At the bottom of your Zoom screen, if you go where the chat and Q&A functions are, you'll see a little globe function and its interpretation. So you should be able to listen in either French or Portuguese to today's presentation. So I have the honor of introducing Daniel Kaptimer, and he is going to tell us about sub-award management within his organization. So Daniel, please take it away.
Thank you so much, Catherine. Good morning, good afternoon, and good evening, everyone. My name is Daniel Kaptimer. I'm the Grant and Compliance Manager at Integrated Service on Health and Development Organization, ISHIDO. My presentation will focus on best practices in managing multiple local sub-awardees in Ethiopia and sub-award management and models and good practice. Next slide, please. Yeah, the project ISHIDO has been implementing since August 2021 is family-focused HIV prevention current treatment activity. And the project runs through August 2021 to August 2023. It's a 3 years project and with 9.9 million USD budget. ISHIDO is a prime organization with 6 local sub-recipients. ISHIDO has more than 20 years of experience in managing USAID funding. So now ISHIDO is a local prime organization and managing 6 local sub-recipients. Next slide, please. Yeah, the project is implemented in Oromia region, the largest region here in Ethiopia, and the project focuses on 41 selected sub-national units in Oromia and has a population focus of 1, children, adolescent, and adult living with HIV, 2, those on ART but not achieving viral load suppression, and 3, 9 to 14 adolescent children for primary and HIV violence prevention. Next slide, please. Yeah, the 6 local sub-recipients you've seen in the right side of this presentation have been involved in different project implementation cycle. Around 2017, these 6 local sub-recipients have been under 2 international partners, FHS Risk and Project Hope. So in mid of 2019, some like 3 local organizations, including Ishido, has been awarded a fixed amount award as a local primes. And in the third stage, there have been, Ishido has been awarded a prime cooperative, 3 years cooperative agreement, and with this 6 local sub-recipient. To make this prime agreement effective, there was a significant support from USAID. USAID extends support through ASAPs, through technical support, like during the concept note, proposal, budgeting, and planning stage. Ishido as well making ready startup activities like onboarding new staff, technical staff, and operational staff, as well as making ready the operational system. Next slide, please. One of the operational areas which Ishido has focused to manage this 6 local sub-recipient as well as a cooperative agreement is that putting in place a sub-award management system. So the sub-award management system has different aspects. Ishido, when awarded the cooperative agreement, started to do a risk assessment for all local sub-recipients to identify gaps in financial management, grant regulation, and compliance as well. Once we know the risk level of organization, we have planned a monitoring plan, a sub-award monitoring plan based on the risk level. So the risk level has been an input to plan a sub-award monitoring plan. So some sub-recipients have a medium risk level. So we incorporated those risks with risk mitigation strategies in the sub-award agreement as special award conditions. There is also a regular and targeted supportive supervision using a standard grant monitoring checklist. So we conducted a quarterly monitoring and supportive supervision plan for all sub-recipients. One of the important aspects we included in our sub-award management system is that we have applied an effective system of advance payment mechanism. Since this organization, local partners, do not have other general fund, we have to come up with a system that works for them to manage their liquidity. So we applied a 60-30 advance rule, which we provided 60 days of advance at the start of the project, and we provided subsequent 30 days advance once the sub-recipients liquidated the previous advance. We have also included a monthly financial report, sub-award financial reporting system, whereby we check the costs that are incurred in line with USAID regulations that are reasonable, allocable, and allowable. We have also used the sub-award tracker to monitor sub-recipient disbursement, liquidation, and burn rate. Next slide, please. Yeah, using this sub-award management system as well as the obvious comparative advantage Ishido has as a local partner, like including Ishido has a comparative advantage as a local partner and better understanding of the local context, since both the prime as well as the sub-recipient are functioning in similar legal and regulatory framework. So we understand whenever there is a challenge in tax or labor law issues with sub-recipient. Second, there is also comparative advantage in terms of cost effectiveness. As you know, local partners have relatively lower overhead cost and also less indirect costs. So we use, we run a cost-effective project, and the cost saving has been directly go to program implementation and beneficiaries. There is also a sustainability issue here as a comparative advantage. As you know, real sustainability driven by local ownership and also leadership. The leadership include like the planning, budgeting, implementation, and also the critical role of oversight. So from this process, we come up with good practice and results. As I mentioned earlier, we have made a quarterly review of the 6 sub-recipients. So we identified that there was an improvement in local sub-award financial management, grant compliance, financial performance, and improved burn rate. So when we see the burn rate, there was an increased percentage in 61% in Q2 and Q3, and also there is an improvement in gaps like unallowable cost and grant compliance. Unallowable cost has been decreased by 29% in Q2 and by 40% in Q3. The grant regulation and compliance findings, which we have been monitoring in the last 3 quarters, are significantly improved by 53% in Q3. Next slide, please. Yeah, the conclusion and the lesson that we proudly share to other local partners is that having a robust sub-award management system that includes risk assessment, monitoring performance, financial payments and reporting, improved financial management, grant compliance and burn rate of local partners. So we advise local partners need to invest in establishing in their operational system, like including grant finance procurement, so that they can run a cost-effective and project. So we can conclude from our experience that local partners can successfully manage USAID cooperative agreement as a prime if they provide the opportunity and the support. Thank you very much.
Thank you so much, Daniel. That was a great presentation. As you know, I have a deep appreciation for sub-award management, and I really am excited to see that a local prime partner taking that role and proving that you can do it. So I look forward to asking you a few questions in just a moment, but first I'm going to ask Wanjiru, who is the Wanjiru Giteya, who is the financial management specialist, to go ahead and start her presentation. I'm glad that you were able to get your camera working so we can see your face this morning or this afternoon for you. So please take it away.
Thank you, Kathleen, and welcome everybody. My name is Wanjiru Giteya. I work for Center for Health Solutions, Kenya, and I'll be sharing with you today on our best practice of harnessing efficiencies of utilizing mobile payment platform. So Center for Health Solutions Kenya won an award from USAID in September 2018 for a 5-year period that was to implement tuberculosis accelerated response and care in conjunction with National TB program that works within the 47 county governments with an objective to reduce incidences of TB and number of deaths due to TB. This was a follow-on award from a previous award in 2013 to 2018. And the total award of our current grant is $34.9 million. We work very closely with other HIV and TB implementing partners funded by both USAID and CDC at the various counties. We have one current sub-awardee who is a Stop TB partnership, and this is a national arm of advocacy for national TB program. Next slide, please. Thank you. So USAID funds the national TB program through TB Act 2 activity, and TB Act 2 activity works very closely in conjunction with national TB program to implement the TB programming in Kenya. It is important for TB Act to understand how the national TB program works, and this is what I'll be sharing with you. So the national TB program works through TB coordinators who are vested at the 47 counties. So there's 47 county coordinators, and those are further subdivided into 290 TB control zones. So we have about 337 coordinators that support the national TB program on a monthly basis to go to health facilities, to capacity build the healthcare workers there, to cascade that's coming, as well as managing the data surveillance for TB. In conjunction with that, National TB program partners with National TB Reference Lab to ensure good quality of diagnostics. And they work with 144 healthcare workers every quarter who ensure external quality assurance, as well as optimal utilization of gene expert. In addition to that, the National TB program also makes payments to MDR patients. These are drug-resistant TB patients, and DOT nurses who support them to ensure that they can access treatment. And from time to time, the National TB program also organizes trainings for the healthcare workers in order to cascade in new information, guidelines, and that kind of thing. So we have training sessions that would be going on from time to time with an average participants of about 40 people in multiple countries. It was therefore important for TB Act and National TB program to come together and evaluate how we can have an efficient platform to make payment reimbursements to all these healthcare workers in a timely fashion to ensure seamless continuation of service delivery. Next slide, please. So the journey to mobile money platform has evolved over time. Initially, payments to healthcare workers used to be done through cash payments, and that came with quite a number of hindrances with regards to having to get the money across. There were security issues. That evolved to utilization of bank transfer platforms that took away some of the disadvantages of cash management systems. And a few other hindrances were also encountered with bank transfers because of there was low coverage of the banking system in the country. The transfers were not real time, and it wasn't possible to confirm who the recipient of the money was until the money had gone. So if there was any transposition errors with bank accounts, then there would be incidences of loss or wrong payment. The introduction of the mobile money platform that came in was offered a great opportunity for the National TB program together with TB Act to leverage on. And this had several advantages that countered the various hindrances that were there with the previous mobile payment functions. For example, the mobile money transfer had a wide reach. It was possible for all the various stakeholders that National TB program works with to have a handset. It was also possible to verify the recipients of the funds before the funds are transmitted. The transfers were also real-time. There were inbuilt internal controls all the way from the sub-county level to county level to National TB program, and then to Center for Health Solutions Kenya as a paying agency. This then therefore enhanced efficiencies of completeness and accuracy of payments being done. We also had a good gain of reduction of paperwork as now the requests were transmitted electronically. Next slide, please. The development of the mobile money platform, which we call Tibu Cash, and Tibu means cure, started way back in 2012 before Center for Health Solutions actually started working on this program with National TB program. We then started making enhancements since 2014. Between 2014 and 2018, we made tremendous improvements on the platform, addressing any challenges that had been identified. And recently, between 2019 and 2020, in response to the call for journey to self-reliance, there has been heavy investment on Tibu Cash management. And this has involved a knowledge transfer from the developers to the ICT team at National TB program, as well as equipping for a command center where the National TB program can now manage the entire ICT scope for data surveillance and payment system. Thank you. Next slide. We have witnessed several results as a result of using the mobile money platform, including we have been able to transact 102,248 payments with the platform since 2014. We have improved our turnaround time for paying participants for their reimbursements, and this ensures continuity of service delivery and for the patients, access to treatment. We have been able to transact a total of $13.4 million. And with good audit trail for that, because the system gives us good trail from request to payment and reviews. Next slide, please. We have also enjoyed reduced costs, and these have been transferred to other programming priorities. And this has been from reduced documents, so we no longer courier documents from the TB control zones to Center for Health Solutions Kenya. We no longer need archiving costs for the bulky documents. The automation of the request supervision lists, then that means no more printing. There has also been efficiency in terms of human resource capital for finance officers, one being able to manage and pay several recipients. Our recipients are also able to get notification for the payment they get, the reason for that. And then the platform has been now uptaken by other implementing agencies that support National TB programs, such as Global Fund through AMREF Health Africa. And this one has been very useful on continuation of payment of patient support that has been handled by Global Fund subsequently. Our stakeholders have given us feedback of how happy they are with the timely payments, and that ensures that they're also carrying their duties with joy and enthusiasm. Next slide. So some of the key lessons learned through our journey of this system development that I'd like to share with you today is that investment in ICT infrastructure enhances accountability. It provides for a good information trail, and above all, very quick access to data and information that would aid them in decision making. Secondly, as a local partner, the Center for Health Solutions as a local partner has been able to work with the local national TB program and identify local technical service providers for development of this service. And thirdly, ICT infrastructure is a business enabler, and we have seen this by good involvement of all stakeholders, from the design to the inception of the identifying the problem, training and development, and then utilization. Actually, by the time we're rolling out the system, the users were really looking forward to it because they could already anticipate the gains that they would be deriving from using it. And fourthly, but not least, we are very happy with the investment of USAID in development of the ICT platform of TIBU patient management system and TIBU Cash that I just talked to you about. And would like to encourage USAID as they work with and board on new local partners to really give ICT investment a priority, as it helps to enable businesses processes flow much easily and seamlessly, and would harness a lot of operational efficiencies. And next slide. Would like to acknowledge all our partners within the TB2 activity, starting with the National TB Program. We are very thankful for the generous contribution of American people through USAID and PEPFAR. We have worked closely with the Union, Find on Diagnostics, Stop TB Partnership on Advocacy, Population Services Kenya on demand creation and awareness, and Kanko Kenya on engagement of informal sector. Thank you very much, and I look forward to engaging with you.
Thank you, Wanjiru. I really look forward to asking you a couple of follow-up questions in the chat, and I can see that a couple of folks are already coming through with questions about your long-term investment in your operational systems and how you've seen impact through that. And as somebody who's actually seen, those reimbursements take a really long time, I know that informal feedback where people are not frustrated and they're able to just focus on their job is actually a really important function of those operational systems, to let people focus on their technical work and everything. So thank you very much, and we'll come back to you with a couple of questions in just a few minutes. But first, I have the pleasure to introduce to you Jerome Burke, who is the communications coordinator with Jamaica AIDS Support for Life, and he will be presenting on their ICT strategies and communication strategies. So please take it away, Jerome.
All right, thank you, Catherine, and good morning to everyone. Well, it's morning here in Jamaica, so I'm hoping everyone is having a great day. So today I'll be doing a quick presentation around using ICT strategies to reach key population. So a little bit about the organization that I work, Jamaica AIDS Support for Life. I can proudly say that we're celebrating our 30th anniversary this year. We provide direct care and support for over 900 persons living with HIV. We have developed a partnership with PEPFAR for over 9 years through our Ministry of Health and Wellness, but an independent partnership over the last 2 years, which has been going absolutely great. Next slide, please. In terms of background, so I'm not sure how many persons are familiar with the Jamaican dialect. So the communication campaign that we developed, we call it Do It Safe. And the translation for that in English is Do It Safe, right? Why is it that we were led to do this campaign, when we looked at the data and what was happening, we saw that over 32,000 Jamaicans would have been living with HIV. And when we did a deeper dive in terms of the population and the groups that were most vulnerable and affected, we realized that the MSM and transgender community would have been greater affected. So we wanted to develop a campaign that would have been able to directly reach them, right, around safer sex messages. And they also shared through a study that over 82% of them met their sexual partners online. So we were very deliberate about interrupting those spaces where it is that they were meeting their sexual partner with safer sex messages. And they also would have shared that there continues to be a low condom and lubricant usage among these groups. So again, that would have been why it is that we thought it necessary to do a campaign, and thus the name Do It Safe. The input for this campaign and what made it work. Also, I must share that all the images that you're going to see throughout this presentation would have been images that we created ourselves after testing these messages. So what made it work? We have a communications unit at Jamaica AIDS Support for Life that consists of myself, an in-house social media officer, and an in-house content developer. That has been quite useful. All of this has been handled in-house instead of outsourcing. We would have invested also in smartphones, laptops, and cameras, again, building out our own system so that we can capture the images and videos and the different materials that would have needed for this campaign. Also having access to clients and members of the key population. I would have mentioned that we directly support over 900 PLHIV. We're able to test our messages prior, during, and get our feedback after the campaign. So we were able to know what would have had greater impact in terms of engagement and visibility. Next slide, please. So the overall objective of this campaign would have been to increase knowledge around reducing HIV transmission among the key population that I would have mentioned. And importantly for us, it would have been to offline and link the key population to our HIV testing and treatment services. And we would have been doing the rollout of PrEP around at the same time. So we wanted to increase the uptake of PrEP, especially among the MSM and TG community. Next slide, please. So what were the strategies that would have employed throughout this campaign? It would have been a myriad of strategies, but those that highlighted here would have been a robust social media campaign utilizing Instagram, YouTube, Facebook, and then those platforms that we know are frequently used by the MSM community being Grindr, Badoo, and Tagged. We also did a lot of influencer marketing, partnering with those local socialites or ambassadors, as we would call them, the promotion of online outreach. So again, it would have been very important for us that we're actually offlining persons, and branding and promotion. So partnering with what we will describe as hotspots and places that we know are often visited by members of the key population. Next slide, please. So our social media campaign, right? Again, mentioned that we would have utilized all the various social media platforms. So we created a list of key messages. So anything that we posted, we use our hashtag #DoItSafe as a way to track our level of engagement. We also did a series of go live sessions. We had to build out a program around this called Just Laughter Dark. So what we would have been able to do is every Wednesday, we would have done a series of live conversations, having messages around sex positivity, and just having persons being comfortable talking about sex, right? And we also did weekly quizzes, so we could always track persons' knowledge and their level of engagement, which would have been an objective of the campaign. Next slide, please. All right, so this one I'm excited about. It's our messages that we were able to develop with the various key population, and specifically we built out some trans messages. So we reached out to the trans community, a local trans organization, and asking them what are some of the messages that would work and resonate with their population, and how best could we represent them in this artwork. And they spoke about looking fabulous, looking glammed up. So we took that in consideration, with, again, bringing them into our studio, our office, but we built out a little photo room, having these images captured, and again, shooting these out. These images actually went viral in the trans community, again, because of how they were represented, feeling very authentic and relatable to the trans community. Next slide, please. So another strategy that would have been utilized is the influencer marketing. So early, before we started the campaign, we met with members of the key population to ask them, who are some of these influencers that you often engage with on social media, or when they post images or anything on their platforms, you often engage and interact with them. So we made a full-on list of those persons, and we reached out to them and developed partnership, and we did again a series of go live session or have them share our artwork or incorporate them in our messages that were created. The spillover from that is when we did the go live, their audience who weren't necessarily following our page or engaging with our messages started to do so or become very aware of the messages around safer sex. So that was a great yield for us in terms of following. And then a cool activity that we did was the distribution of influencer boxes. So we literally got boxes and packed them with branded shirts, tights, water bottles, and of course, condom and lubricants. And we gave these to over 30 influencers. These influencers in return shared those messages, shared these boxes and unpacking these boxes on their platforms. So individuals started following our pages, wanting an opportunity to win one of our Do It Safe boxes. Next slide, please. All right, so what was very important for us? What was the point of all of this? And how is it that we're tracking to make sure that our messages were actually leading to offlining and persons actually uptaking our services? So we had what we call the MyLJA platform. So it's an online reservation application that persons are able to click on a link and book testing or treatment services. Right. So throughout the period of the campaign, we use a special code. So persons who interacted with our messages, whether through our direct platform or any of the influencers or any of the spaces that we would have gone into, they could have booked. And again, we were able to track those numbers throughout the campaign and seeing where persons were coming from and the extent and reach of offline throughout. Next slide, please. Okay, so again, this campaign coincided perfectly with the rollout of PrEP for us as an organization. So we created messages pushing PrEP as a part of your combination prevention package, PrEP as a part of doing it safe. So if you were in a third discordant relationship, if you were high risk, if you were a part of the MSM and TG communities, of those persons who came in and got tested, and after going through the screening process, we realized that they would have been eligible for PrEP. We created a whole list of messages and artworks around that. So the images that you saw here again would have been images that appealed to the various community, and we placed them online so persons could again also develop their knowledge about what PrEP is and if they were suitable for PrEP. Next slide, please. All right, so branding and promotion was also important for us. As you can see, I'm wearing one of our Do It Safe shirt here. So we created novelties that we thought were practical, usable, things that the focus group, the focus group identified that they would enjoy having and using and interacting with. So like t-shirts, water bottles, tight for the MSM community, especially big on working out and exercising, dominoes and Ludo boards. So when friends gather or hanging out, they could utilize these to play and enjoy to pass time. We also branded some hotspots and gyms. So the guys that you're seeing, the top guys throughout, we infiltrated one of the gyms. So we did a partnership with 2 gyms locally and placed our messages. So the guys that you're seeing on the image are actual gym trainers. So they came on board and were able to brand, take the images and brand them and place them in the gym. So when persons are in those spaces working out, again, they're able to see those messages. And we also did a series of partnerships. There are a lot of, due to the COVID-19, a lot of persons started hosting and doing online YouTube series, like literally taking their phone and creating series online. And we realized that the Jamaican populace started watching a lot of these series. So we started placing our Do It Safe messages in these series, giving persons our shirt. Again, that proved a way for us to push the Do It Safe messages and through partnerships and branding. Next slide, please. Okay, so this is an example of one of the shops that we would have branded, like literally went and branded the shop. So you're seeing our images on that. So this is in St. Mary, a parish in Jamaica, and it's referred to as the Do It Safe shop. And actually, one of the positive feedback from this is the shop owner has expressed to us that because it's now a condom distribution site for us as well. So the guys in the community will often just pop by and ask for a condom or lubricant. So we're actually building out some more of these shops as well. And it also works for us because it has developed trust whenever we, as an organization, we go into these communities for any form of interventions. The level of trust is around them and the familiarity with the organization is being developed. Next slide, please. Okay, so out of all of this, what were the results? So we were able to offline over 200 MFM and TG. In terms of, again, PrEP would have just been the rollout of PrEP. So a lot of messaging around PrEP was done during that time. So we got over 70% being enrolled on PrEP. For us too, there was a spike in our social media platform, over 63% growth. On Instagram alone, we were able to move from over 3,000 to almost 6,000 persons on the platform. And then in terms of HIV reactive cases, not just including MSM, but over 16 new cases would have been found. Next slide, please. Other outcomes that would have also been seen through the duration of this campaign is increased visibility. I think we would have been able to reach over 800,000 persons. And again, this came from the analytics pulled from our social media platforms. And a lot of this came from our reach across YouTube. And I would have spoken about the partnership with local persons who started creating videos for YouTube. So there was that too. And our influencers who have large following on their social media platforms who started sharing our images as well, our images that we created with them. So we were able to pull those numbers and see those reach. We saw where, again, Jassel now becoming a greater, well, we were already, but in terms of just the trust, becoming a trusted source for HIV testing and screening. And interestingly, when we started the campaign, partnering with influencers, some of the persons who we wanted to come on board, they were quite reluctant, wondering what it would be to use their image and likeness on a message around HIV. But interestingly, by the end of the campaign, we realized that they were not so reluctant. We were able to full on do a capacity building with a lot of these influencers that were utilized, having a better understanding and becoming messengers and pushing the messages on their platform, even when we're not engaging with them. Thank you. So that's the Do It Safe campaign. And again, I mean, this is the Jamaican dialect, so you may be wondering what that is, but the English translation is really just Do It Safe.
Thank you, Jerome, for that presentation. I hesitate to say it, but you've kind of proven that anybody who said operational systems aren't sexy, I think you might have changed that perception with your presentation. So thank you very much to all three of our panelists today. And now we're going to take some questions. I see that the Q&A box is getting pretty active, where colleagues from USAID and other local partners are asking questions. So I will, in just a moment, I will pull those up and go through those questions. But to kick it off, I have a question for each of you, and you can go in the same order of your presentations, or if you have, an immediate reaction, please go ahead and answer. But one of the themes that I saw in all three of your presentations really was that over time, I mean, whether it's 12 years, 9 years, your organizations and USAID have invested in these systems. It takes a while to get these kinds of systems to be fully functional and showing the kind of impact that you shared with us today. But we have a lot of new local partners joining us for this year's local partner meeting, and I'm sure that they are also very curious about advice on what to do, where to start, and you've had several years to build these up. So what is your advice to new local partners who are starting their journey with USAID and getting their operational systems up and running? So I'll go ahead and let you all have a think about that, and I will pull up the questions from our audience. So please feel free to answer in any order.
All right. So for me, what worked for us, especially again, looking back through communication lens, I'm able to speak on that directly. I know my colleagues could broaden the conversation, but I would boil it down pretty much to ensuring that you test, evaluate, and improve. So I know a lot of times when we go into creating, we oftentimes see the outcome and we're sure in terms of what it is that we want to achieve, and we're already there before going through the process. But what worked is, again, testing your messages, testing whatever system it is, finding those persons that would be utilizing and ensuring that they get an opportunity to give you a feedback, ensuring that it's a participatory approach style prior to going to a full-on launch, and ensuring that there are evaluation mechanism all throughout so that you're able to track your results and what it is that is happening. And again, and having identify and track what is happening, improve. So when it is that you know that this was the outcome that you were hoping to achieve and it's shifting and it's not working that way, so you're able to make those necessary changes.
Okay, thanks, Catherine, for the question. From our experience that we have drawn a good lesson and what we can share proudly for other local news prime partners is that investing in operational systems will pay back. In most of the time, like local partners have been challenging with restricted funds. Like most of them, especially in our case in Ethiopia, most local organizations have restricted funds, so they tend to spend most of their award money on the direct program implementation. So the operational aspect of which is important in terms of compliance and also delivering a cost-effective project implementation will not get as much as attention as it requires. So investing and giving priority as well for operational systems, like it could be finance, grants, procurement, and as other operational areas will make local partners more sustainable and more effective. Thank you.
Thank you. And for us, a couple of things maybe I could share. As you have clearly outlined, it has been a journey. So looking at this as a project, but I would like to encourage and remind our fellow peers that the first place to begin is to understand your award, just in case there are various compliance issues that will be required, especially on ICT development requirements. Make sure you align with that, get your requests to USAID on time, and keep engaging on that discussion. And then secondly is to identify your stakeholders very carefully so that you have the right people at the table from the onset, and you can start. And this also means that you'll be able to address the requirements and the needs for the various stakeholders. And then thirdly is to have a very well organized project governance structure. When we're developing Tibu Cash as well as Tibu patient management system, we had a governance structure, and that the hierarchy of the governance structure, we call it a policy team. And with that, within the policy team, we actually had representation from USAID through our AOR, and then we had all the key stakeholders, that's Center for Health Solutions, Kenya, we had National TB Program, and then the CEOs of the developing contracted developers for the solutions. And then the other aspect is to develop a very clear scope of what the requirements are, and that would help to ensure that what is delivered is really what you asked for. And then, and lastly, I would say to have a very clear communication strategy so that teams and various stakeholders are involved at different points, they're informed of what is happening, we are tracking milestones and things like that. And then finally, I think I would say, looking at a big project like this, it is helpful maybe to break it down because the funding might not all be available at a go. So Rome was not built in a day. These systems are not built in a day. It's incremental, priority first, and then have building blocks and keep building and adding onto that. And eventually you'll have a complete system as you wish. Thank you.
Well, thank you all for those comprehensive answers. I see that we have quite a few other chats. I'd love to, ask a bunch of follow-up questions. I could have this conversation with each of you for hours, I think, but we have a lot of questions, particularly from USAID Eye Care in Uganda. So we have, I think he has 4 questions, or he or she. So I'm gonna just start from the top. The first question that came in was for you, Daniel. And in the case of sub-award management, Fulukas from USAID Eye Care Uganda says, can Ethiopia share with us experience of managing fraud, if any, of the sub-awardees? What controls did you put in place to prevent fraud with your sub-awardees?
Thank you. I think it is an important and critical issue in managing, especially in sub-award management. So our experience is that we try to implement, 2 strategies, preventive and detective strategies of risk management and fraud management. So by preventive, we support from ASAP, technical support from ASAP. We have started to implement a fraud register, which will identify the risks in terms of in operational areas, in program implementation, like including fraud and risk are not only in financial management, but it could be in data fraud or any program implementation. So we try to identify what are the risks in the project, and we try to see it from the impact and likelihood of the risks and frauds. So based on that, we plan a risk mitigation plan so that we can see where are the risks, with high likelihood and severe impact. So this is how we try to address in preventive strategy. In detective, as I mentioned, we in terms of sub-award monitoring, we have a good system of monitoring plan, and the monitoring plan will include as well the risk levels we identified during the pre-award stage. So we have a quarterly monitoring of each subrecipient, but based on some risks, we might increase the frequency of the monitorings we do. So in this case, we try to detect if there is any areas which lead to risks or frauds. So sometimes when we review invoices or financial report, we might take surprise visits and or surprise documentation. We require documentation from our subrecipients. Thank you.
Yeah, those are really important points. Fraud is not just picked up after the fact, and those prevention measures, those ways of monitoring can help you along the way. So thanks for clarifying that for us, Daniel. A question for Wanjiru. Did your organization, the local partner, did your organization develop Tibu Cash system, or is it a system from a third-party mobile solutions provider? And how do beneficiaries actually access the cash from the mobile money wallets?
Thank you for that question, Fulkas. So yes, Center for Health Solution together with National TB Program actually developed the TB solution through an ICT expert in that area. Our critical criteria for getting the solution provider was a provider who had good experience of managing money electronic transfer platforms previously successfully, and our partners had actually done that. But with regards to the development, we outlined what our needs are. They developed and enhanced the system to our requirements. So I would say yes, it is possible to get a development based on what your needs are, as long as you identify those correctly, and then select a competent, capable service provider to deliver on the solution. Thank you.
That's very helpful, very important advice to follow. And then I have 2 kind of related questions for you, Jerome. around your influencers. Now, I'm no social media expert, so I hope I don't botch these questions, but I want to be sure to ask them of you. So I'll ask them both, and then you can choose how to respond. So to Jerome, are the influencers celebrities, or are they something else? If they're celebrities, what sort of sector of celebrities would you find being more influential? And then a similar question from Sylvia asking, how did you manage your engagement with these key influencers? And what was their motivation to engage with your campaign?
All right. So interestingly, so let me start with, okay, the first question first. So in terms of the influence of being celebrities, right? Literally what we call them locally is social media influencers in the truest sense, because these are not necessarily persons who are musicians or artists or anything of the sort, but seemingly whatever it is that they place online, whenever it is that they go live, whenever it is that they're supporting a particular product, persons often engage with them. These are persons who will be at home and they go live on their page, and in minutes you have over 300 or 400 persons on their platform, and it can go up as their conversations continue, talking about any topic, just lending their voices to any topic and sharing their opinion about any topic, right? So for us, it was finding those persons. One of the benchmark for us is that the influencers that we engage with, they had to have over 10,000 followers on a particular platform. So we looked on their TikTok mostly and their Instagram pages to see, do these persons have over 10,000 followers, because we wanted the eyes on our campaign. So that was necessary for us, right? In terms of how it is that we were able to manage these influencers, we gave them specific tasks because we were signing them and working with them. So firstly, we built out a capacity building exercise. So we actually had a full-on retreat where we spoke to them about message around prevention, treatment, stigma, and discrimination. So they themselves could understand what it is that us as an organization do, and by extension, the work around HIV. So we didn't want there to be any gray area where they themselves become saying anything on their platform that we would find to be disruptive or against the message and the overall objective of the organization. So that was one. Then we were very granular in terms of saying that you will have to post 2 times per week, you'll have to do 2 lives with us. So that type of engagement and that type of responsibility and that type of clarity around what it is that we would want for them in terms of the campaign. And again, through USAID partnership, we would have been able to achieve this. I know one of the concerns would have been around branding. I saw that that question, but beneficial to us is that our local USAID partner, we would have been able to shoot across these messages just to get approval whenever branding, the USAID brand, our logo would have been utilized before it is that they were placed across any of the platforms. So that would have been a key thing to do before anything would have been shared. So there were messages, and just for clarity, there were messages that would have been developed that we would not have necessarily placed USA logo on, but again, these would have been messages that the key population interacted with. So whenever our messages were approved, those messages would have been shared.
Okay, that's a very comprehensive answer, and thanks for picking up on one of the other questions that was in the chat, Jerome. These influencers, kind of like local celebrities, but not quite, full-on celebrities. So that's very good to know. And then I will come back to you, Wanjiru. We have a couple of questions here related to your mobile money payments. We have an anonymous attendee who has said that they totally agree that mobile money payments are the way to go. And they also relieve technical teams off this task so that they can focus on their technical roles. However, some partners find this transition especially challenging when mobile service providers in the country are not quite advanced in these bulk money payments. So where does a partner start? I think it's also acts to stop fraud temptations when so much money is transferred into staff accounts. And then there's a related one around, so where does a partner start in terms of when mobile money and bulk money payment systems maybe aren't as sophisticated in their country, but also the challenge of low cell phone ownership among clients, which may pose a hindrance in some of the countries that the local partners are represented today. So how that could be overcome as a hindrance to converting to mobile money payments.
Okay, thank you, and very great input. I think the anonymous attendee is agreeing that this is the way to go, and the challenge is if the mobile service provider is not as reliable. I think my response would be the starting point to engage, because as you saw, for instance, in our case, we have moved quite a lot of money, and the back of ensuring that the money goes to the right person and in the right amount stops with a prime partner. It is very important to ensure that the mobile money platform in the country is reliable. And in the event that that is not, then I would advise that you opt for another option that will ensure safety of the resources and that they would reach to the intended recipients. With regard to the question on the issue of the gadgets to be able to get the money, so that's a good point. I think what I've seen happen is over time, the cost of mobile gadgets has really reduced, and that has increased the access of these to various to the populace. And I think also there is a point there in terms of programming to sell these, for those who may be struggling with that aspect of people may be asking how to get the gadgets. I think the point is to sell the need to have, because then the benefits for the recipients are also far-reaching, that the intended money will go to the intended recipient. So for us, we have a registration process where every beneficiary has their number, and if they were to change that number, then there's a whole approval process for that to be put in the system to ensure that that is the intended recipient and that is their number. So I would encourage that we encourage our beneficiaries to also invest a little in the spirit of sustainability and doing this together for the good of all. There was a part of a question earlier, sorry, that I missed out on. Someone was asking, how do beneficiaries access the money from their wallet? So there are three avenues, I would say, in our case. That one, a recipient, once they have the money in their wallet, they can send that money to someone else who probably they needed to get the money to. They can also use that wallet to procure goods from various points, and they can also withdraw cash from an authorized agent of the mobile money platform provider. Thank you.
Great, thank you, Wanjiru, for looping back around to grab that last bit of that question. I let that one go, sorry about that. So we have a couple more questions in the chat, and one is also a little bit of a follow-up question, Wanjiru, about money transfer tax, or whether it's tax or charges or fees. So thanking you for the presentation, but please share with us the experience of mobile money transfer tax, which tend to increase the cost of transfer, which may increase the cost of doing business. So if you could give us a little clarity on that one.
Okay, so my interpretation for this is the sending transaction costs. And for us, what we did is to analyze. We did a cost-benefit analysis of what is the other cost of any other mode of transmitting the funds to the intended person. As I shared, we had two previous modes of payment, one being bank transfers. Those also cost per transaction. And then the older mode, which was cash, really comes with a lot of risk, which can be quite costly. So the cost for transferring money using the electronic transfer far outweighs all the other hindrances by the other two modes. and frees up time. Someone just shared there. It seems from what they shared is that like the technical staff are the ones who are charged to go out and make payments to the beneficiaries. So it would free up time for such technical team to do what they need to do. It also it's also efficient in that we will not need too many people to be able to disburse funds to the beneficiaries. And our case was quite unique because we serve the entire country. It's expansive. 47 counties. The numbers I shared with you are many, so we really needed a solution that would be effective and efficient. So the cost for transfers it's outweighed by the benefit. Thank you.
That's a really, really good and important point. I experienced similar when we were actually working in Syria. And while the cost of transfer through our particular service providers, the tax or the fee was quite high, it was surely better, safer, and worth the investment than literally carrying a bag of cash to distribute to beneficiaries, which was the very old system that we were working on. So I can definitely watch that cost benefit and see that that's certainly worth the investment. So I have one more question for it's kind of for all of you, but I'll start with you, Daniel. And I think that each of your presentations in a different way kind of touched on this. So maybe Wanjiro and Jerome, you can follow up. So your organization as a local prime partner, you have local subs. And so are there any unique relationship or other kind of challenges that you face as a local partner managing other local organizations? And what are sort of the benefits of it being local? So for instance, in Jerome's presentation, we see that the tweet safe, I mean, when I read the abstract at first, I was like, what in the world does that mean? But you're able to, as a local partner, reach audiences by using the local slang. And for you, Wanjiro, you know, the systems of mobile money payments in Kenya are well known for being quite advanced, and I'd say actually more advanced than we have here in the US. So you have a kind of a comparative advantage as being a local organization, making use of the systems that already exist. So a little bit of everything for each of you, but maybe Daniel, if you could start off in terms of that management of that relationship with other local partners.
Thank you, Catherine. I think this is a very important issue. Yeah, this is the first experience for Ishido, our organization, to be a prime working with local organizations. So most of the working environment situation, the prime and the subrecipient will share similar challenges as well. If I mention, I think one of the unique relationship or unique challenge is that the resource or the financial structure or the grant portfolio, both the local prime as well as the local subrecipient have. For this case, as I mentioned earlier in my presentation, most of local organization here, be it prime or subrecipient, their funding is depending on restricted funding, like for restricted purpose. So they don't have as such general fund or unrestricted funding, unlike the big international NGOs. So in case of cash management, liquidity management, this is a big challenge. So for example, if we're working on a cooperative agreement based on advance payment from USAID. So if there is any kind of delay in getting our advances, that would be a challenge since there is no other source of fund to be used for such period. So we identify this is a big challenge as the start of the project implementation. So we try to design a mechanism, an advanced mechanism that address this issue. The 60-30% advance rule we use is that we try to provide 60 days advance at the start of the project for all subrecipients. So whenever they report their next month's report, they will have at least 30 days cash or liquidity at their hand. So whenever there is a challenge of getting advances, delays, they will handle it with at least there will be always an adequate cash for implementation or incurring for the any overhead costs. So financial structure based on restricted fund is a challenge for local organization here in Ethiopia, but in our case, we try to address that challenge with a smooth advance payment mechanism. Thank you.
I think I will piggyback a little on Daniel's answer, where he would have mentioned that funding through USAID normally comes with direct objectives and restrictions in terms of how it is that we are able to execute as local partners. But one of the things that is through the presentation from all three of us is that when trusted and when allowed to test and in terms of the system and what we understand from our various countries and our people, and given that opportunity to branch out, we are able to identify those systems that would actually work, those systems that will actually resonate. We do understand that best practices would have been developed over the years, and we appreciate organizations coming and providing support and asking us to utilize these things, but having our own voices being a part of that conversations and a part of those systems, we are able to see and reap way more results and yield. Again, for us, something simple as our language. Do it safe means something to, I mean, the Jamaican language. If I go to someone and say, do it safe, it doesn't have the same vibe, it doesn't have the same hipness, it doesn't have the same slant to it. So even stuff like that around our language, you know, so though it's very important to allow local partners to always double and drop their own spaz on it, drop their own little finesse and bring these things alive, because again, as organizations, we always want to make impact. We always want to reach our vulnerable groups, but it's allowing us that leverage to do so based on what it is that we're seeing happening on the ground, where we're able to see the biggest results.
Okay, thank you, Catherine and the team. Thank you for the recognition of status of a mobile payment platform being quite advanced. So really, as an implementing partner in our stakeholders, we took advantage of something that was available to ensure that we are bringing value to the people with something that they could really identify. It was something that was already being talked about within our context. This new thing and how could it be done, and it brought a lot of advantages. So we leveraged on it, and that has meant that the investment in this platform has, while it was costly to invest in the platform, it also freed other resources for other program priorities to be advanced. So I think the question is to understand the context in which we are operating, to understand what the challenges are, to find local solutions that can be able to propel us to achieve our objectives in the most efficient way. And we might not have a one-size-fits-all. Every situation might require some different strategies. So we are grateful to be in this space and to have utilized this and to share the success of the journey. Thank you.
Thank you all for that. I think, you know, you each in your own way have brought out, you know, the uniqueness of what local partners can bring to programming and value in ways that isn't just monetary. You really bring out the value across through these systems to the implementation and having that impact that is unique because you are local partners. And I think that that's something, you know, we often think of risk as, and I think Daniel, you pointed it out, it's not just financial risk, but the risk of not being local, of not understanding the local context, we don't always think about that as a risk, but when you're trying to have unique messages, or when you're trying to manage your local subawards or reach the beneficiaries with that impact, you are able to do that in a way that maybe others could not. So I think that's something that I'm taking from this presentation, and I really hope that some of our other colleagues are hearing, when thinking about programming with local partners. So there are a couple more questions coming through, but I'm conscious that this session is supposed to end at 8:15 local time, and it is now 12 after. So we've had one more question come through in one of our colleagues added it in French, and this is for Daniel. And there have actually been a couple of questions come through about risk. So I'd like to just kind of, maybe it's a little bit broader, but could you share with us, Daniel, or give us the foundations of your risk-based monitoring and evaluation plan? So I think that might actually have to be our last question. There are some more, but maybe we can get to them if you go ahead, Daniel.
Thank you. Our risk assessment was our base for our SubRecipient monitoring plan. So SubRecipient monitoring plan will include not only finance and grants, also include other areas as well. So the risk assessment will have, as I answered one question regarding what kind of risk assessment in the chat box. We try to adopt from the NUPAS risk assessment, so non-US pre-award survey tool, which incorporates like many areas in terms of financial management, internal control, USAID rules and regulation, and other important areas. So we've tried to score each areas, and whenever we develop our monitoring plan, we try to give emphasis on areas the subrecipients have medium or high risk. So the SubRecipient monitoring plan will capture what kind of risk is identified and how it could be addressed. So one of the strategies we used is that we have regular and targeted quarterly monitoring visits, site visits to the subrecipient offices, both at the head office and their field offices as well. So for some partners, for example, out of the 6 partners, we have one medium risk level subrecipient. So we have additional requirements which incorporated in the as special award conditions that we review financial documents on a monthly basis. So the risk assessment will inform our SubRecipient monitoring plan in terms of frequency, in terms of priority areas and focuses. Thank you.
Thank you very much, Daniel, for that last answer. And I really just want to thank Daniel, Jerome, Wanjiru for your time, and the time that you and I spent together was great, and I enjoyed preparing this session with you. Again, you each brought a lot to this session, and I thank you for representing your organizations and for them being willing to share with us about the evolution of your operational systems. I know that sometimes can be a little bit difficult to kind of open up and show what's going on the inside, but each of your organizations, thank you for helping, because there's a lot that all of us, USAID and other local partners, can learn from your experiences. So thank you very much to all 3 of you for your time and your energy and your effort. And thank you to our audience. We had quite a good attendance for this session. And I hope others will join the sessions that we have. We have a bit of a break right now, and then we'll head into a couple more technical and operational panels. And then we have a closing plenary, very high level plenary with some exciting special guests. So I hope you all will join us then. And thank you very much. Good morning, good afternoon, and good evening to all of you. Thank you.